This is a question and answer session related to trach care. And also, if you have any questions about the suctioning, we could address those at this time also. So, do I have any questions?
Yes, I have one about the trach care. Do you always use tape trach ties, or is there another device you can use?
I'm so glad you asked that question because I do happen to have one here to demonstrate. Many times there are many different types of ties. This one happens to be a Velcro one that is used, and many of them are Velcro. So this would be the adjusting part of it right here, and then this would Velcro and come around in through the openings on the trach, on the flange on the trach. So yes, good question, thank you. Anybody else?
Would you use something, or would you sometimes use two people to change trach ties?
I like that question also because that you could. This can be done by one nurse, but it would be client dependent upon how much that patient can move. If that patient is coughing a lot, you might want to have someone else there. You might be suctioning at the same time. If the patient's unable to lift their head when you're putting the ties around, you might want to have another nurse there. And STNA could assist you also. Thank you.
And how often do you change the trach ties?
The trach ties can be really changed at any point in time, dependent upon whether they have become soiled in any way, because they would be a place for infection to harbor microorganisms. So generally we have an order to clean and the trach, and when you clean the trach you would be changing the ties also. So generally have an order for that. It could be once every 24 hours, it could be once a shift, and you would also maybe have a PRN order to go along with that. So it depends upon the trach and the physician's order.
Would you have them deep breathe after trach suctioning?
Yes, we do have them either deep breathe, because once again we have removed the oxygen along with it. Did you say after trach or after suctioning? Or both? Yes, after trach care. Yes, after trach care also we would think about oxygenation because we have been in that airway cleaning and manipulating that inner cannula in and out. So yes, we want to think about oxygenation then, so we could have somebody deep breathe right after we have finished, or even during the procedure we could have them deep breathe and or replace their oxygen if we see any signs that they are struggling with breathing. And we do the same thing with the suctioning, so I appreciate your asking that question.
When inserting suction catheter.
We have another question?
Yes.
Okay.
When inserting a suction catheter, how far do we insert it?
Nasopharyngeal and nasopharyngeal we estimate 5 to 6 inches to get back into the pharynx. And when I was doing it, I actually knew I was in the pharynx because I could feel the back of the tongue with the tip of that catheter. And when we are doing tracheobronchial suctioning, we're thinking 4 to 5 inches, unless we meet resistance. And then we're going to, either way, we're going to withdraw a ½ an inch so that we're not causing irritation or erosion at the crine of the trachea, which is where the bifurcation of the trachea is into the bronchioles.
I had a question. Is there really such thing as magic dust, and where do you get it from?
We are going to talk about this question after this taping, but no, there's no such thing as magical dust. I'm mildly embarrassed that I made that error when I was doing this, but we were so far into the taping I inserted that so that we could continue. But no, there's no such thing as magical dust. It would be starting over again. Or somehow if I had a pair of sterile gloves, I could get my sterile gloves on, look at my field. Could I rescue that in any way? Anything else?
Are there different types of trachs, and would that make a difference as to how often you would change the inner cannula?
Possibly. Actually, some people that have a tracheostomy have no appliance there at all. It's just healed. Many times those people will have something just to place over that for aesthetic reasons. There are trachs that have disposable inner cannulas. There are trachs that do not have an inner cannula at all that still need to be cleaned. The principles for any of those will be the same as what we've demonstrated here. Anything else to challenge me with? I thank you very much